Parkinson disease is a chronic neurogenetic disorder of the brain. I am Dr. Puneet Agarwal. I am Senior Director Neurology in Max Super Specialty Hospital, Saket, New Delhi. Today I'll answer most frequently asked questions on Parkinson disease. So there is a myth that Parkinson is a only motor disorder. So this is wrong. So if you see that Parkinson does not only involve it does not lead to only motor problems like slowness, tremors or difficulty in walking, but it also leads to a lot of other non-motor symptoms and many times we have seen that patients has these non-motor symptoms even before the starting of the onset of these symptoms, and which are very important to recognize by the neurologist. And many times we diagnose that patient may be getting a Parkinson disease due to these non-motor symptoms. Like many of these cases are developing a depression, many of these cases are developing behavioral issues or sleep disorders, which is a very common hallmark of Parkinson disease. There is a condition known as REM, behavioral disorder, in which patient develop abnormal shouting or abnormal behavior during sleep, and also developing abnormal movements during sleep, which is noticed by the family members. And many times family members comes to us with these symptoms only, and we have to recognize this may be a symptom or initiation of the disease. So as a physician, we should be careful about these symptoms. So which is again, I'll say it is correct also in many ways, and because many of these Parkinson's medicines lead to various other symptoms like in form of dizziness, in form of drowsiness. But although these medicines are very, very essential medication for the patient, because these are the medicines which leads to improvement in the motor symptoms as well as non-motor symptoms like dopamine, levodopa drug, which is a cornerstone therapy of Parkinson. And many times patients stop taking these medicines, which should not happen. So as a physician, neurophysician, we start with the very low doses of these medications and then gradually build up the doses of these medications. Sometimes some of these medications may lead to other symptoms like hallucinations. Patients start seeing certain objects, patients start visualizing or hearing certain objects, and maybe the family members start thinking that patient may develop some kind of psychiatric illness, which is in fact related to the medications. So as a neurologist, we know about these things, we adjust the doses of medication, and patient symptoms become better. There is another myth that everyone with the Parkinson disease has tremors, which is a wrong thing, which is wrong. I'll say note. Basically, many of these. So, if you see in our experience also in the literature also, it is mentioned that 80% or 85% patients they have tremors, but 15 to 20% patients they don't have tremor at all, and it doesn't mean that patient is not having Parkinson. So that is very important to know for the public also. So many times patient only is having a slowness in walking, stiffness in the body, and not having tremor. This entity is known as a non-tremor dominant Parkinson disease. And whenever these symptoms are there, then you have to consult a neurologist. And if the patient is having other symptoms, especially slowness, stiffness, so patient may be having Parkinson, and patient should be treated as a case of Parkinson by the neurologist. So another myth is that besides medication, there is no other treatment of Parkinson, which is again wrong, because Parkinson disease, there are a lot of, although medicine treatment options have come, and we treat many of the symptoms with that medication only, but nowadays there is a role of surgery also in these cases. In Max Hospital Saket, we are doing these kind of surgery known as deep brain stimulation for last more than 18 years, and we have done the surgery in more than 75 to 80 patients till now with a success rate of more than 90%. So patients in the patients who are not responding to the medications, or patients who are having unilateral refractory symptoms, or progressive, or patients who are having a young age patients, having a predominant tremors, which are not easily controlled with the medication, are the right candidate to go for the deep brain stimulation, and they get better. Their quality of life also improve remarkably with the surgery in these cases. There is a myth that Parkinson's disease is a fatal condition, which is wrong again, because Parkinson's disease itself usually is not fatal in majority of the cases. If the patient is a very slowly progressive disorder, and if the patient is treated properly by neurologists with the proper medications, then many of these cases, they live for many years, even more than 15 years, 20 years, or even more than that. So many of my cases are living for many years, even more than 25 years, without any significant complication, and some of these cases have undergone for the surgery like deep brain stimulation later on. But the only condition in which the Parkinson's disease is leading to so itself does not lead to death, but the complications like aspiration pneumonitis, infection of the lung, especially in the bed-bound state, the patient who are having stage 4 Parkinson, in those cases, and having a swallowing problem in which they are not able to eat properly, in those cases they are very much prone to develop a bed sores and the lung infection, and that is a cause of mortality usually in these cases. So Parkinson itself is not a fatal, but definitely some of the complication in the late stage of the disease may be a fatal condition. So there is a myth that deep brain stimulation is experimental therapy, which is again a wrong note. If you see that deep brain stimulation is available for many years in India as well as in all over world, and so deep brain stimulation is a very successful therapy in patients who are not responding to the medication, or patients who are having, especially the young age patients who are developing a predominant tremor, refractory tremors. In those cases, we have treated also with the deep brain stimulation in many patients. Is a very successful therapy. The patients who coming with a debilitated state and not responding to medication, after deep brain stimulation, they become almost near to the normal person. They can walk normally, they can stand, they can talk normally with after deep brain stimulation. Number of medication also reduced by more than 60 to 70% in these cases, as well as it's a very safe surgery. So we are doing it Max Hospital Saket, as I told you earlier, also for last 17 years, and we have treated with deep brain stimulation more than 75 cases with a success rate of around 95%. So the duration of stay in the hospital usually is around 1 week, and we have to just adjust the machine for after the discharge for 15 days and as a OPD patient, and after that patient can be maintained at home very well with a minimum dose of medications. So in conclusion, I like to tell you that Parkinson's disease is a progressive neurogenetic disorder of the brain. If we diagnose Parkinson in an early stage, then we can control majority of the symptoms very well, as well as the patient can lead a normal good quality of life with the use of proper medications, as well as the deep brain stimulation in the patients in which it is required. If you have, I think I am able to broke out all the queries and myths which are prevalent with the Parkinson disease. If you have any further queries, I'll be happy to answer that. Thank you.